It's amazing how the patient, the next day of surgery, he was making flexions here in my office. He come back again to his job, training jiu-jitsu.
This patient our doctor is talking about not only got his life back at the age of 51, he also saved nearly 80% on costs by choosing orthopedic surgery in Tijuana. Hi, I'm Jeline De Vera, and I talk to patients like you every day. People who are hopeful for a pain-free life but unsure about Mexico. So for this video, we went straight to the source, one of the top orthopedic surgeons in Tijuana. We interviewed him for hours, asking everything you want to know about joint replacements, spine surgeries, and alternatives like stem cells. We even got into safety, follow-up, logistics, and what to expect every step of the way. So if you're considering orthopedic surgery abroad, don't make a decision until you see this video to the end.
My name is Dr. Hans Ruiz. I'm a traumatologist and orthopedic surgeon. I make my studies in Mexico City. The name is UNAM. It's one of the highest ranking university in Mexico.
Do you have a lot of international patients coming to you for this kind of surgery?
Yes, I have many patients. Some came from Canada, some from the United States.
And what percentage of your patients come from outside of the country?
50% of my patients come from outside of Mexico. The most important of my treatments are that the patient feel better and kill the pain and they get a best life.
So do you have an idea of how much a patient saves by coming to Tijuana for orthopedic surgery compared to having it done back at home?
Yes, the prices right now in Tijuana are very low compared with other countries. Some patients can save 50%, 80% compared with other countries.
What types of orthopedic surgery do you do most frequently?
I make surgeries of every bone the patient have a fracture, sport damage, joint destruction, or attrition. I can change the joint. Spine surgeries, I can do it too. For the joint replacement, the most common is a hip replacement and a knee replacement. Sport medicine, I can do it, for example, if the patient have a meniscus damage, a ligament broken, I can fix it. If the patient have an herniated disc in the spine, I can remove it and I can stabilize that segment of the spine to decrease the pain.
Okay. And in your experience, what is the success rate on this type of surgeries?
The success is a subjective thing. I think I can say that most of the surgeries are made to decrease the pain. Okay, if the patient had the case of 90% of the pain or 80%, I can say that is a success. We make a lot of surgeries of shoulders to fix the rotator cuff, to fix all the labrum. We can fix the tendons of shoulders. Most of the sport damage, we can fix it. We do a lot of surgery of spine. It's very common. Cervical spine, lumbar spine. If the patient have herniated disc or damage, if the patient need a fusion of the vertebrae, we can fix it. We can do the surgery.
Can you explain to us what is the journey for a patient from the initial contact all the way until they go back home? What is the process like?
The patient get to me sometimes directly, sometimes for an agency. After the patients contact me, we can talk, maybe for a call or maybe a consultation online, and we can talk about the problem. Some patients send me the report of test or the disc or images, pictures, and I can analyze the problem, particularly of every patient, and I can propose a treatment for every patient. And once the patient decides to come to Tijuana to be operated, I can tell the patient it was the hospital when I can do the surgery. The patients choose the day, arrive one day before, and what the schedule. If the patient needs to stay here for 1 day, 2 days, and I explain all the procedure I wanna do and what's the cost of all that. Once the patient is operated, I give a prescription and a paper when I explain what's the next step. When the patient have to remove the stitches, start the physiotherapy, we can still in touch and all the procedure as to the finish when the patient start to work again.
Normally, when the patient comes here and has surgery, what is the average time that they have to stay in town?
If the procedure is small, shoulder surgery, and is something that is not much painful, the patient can go back to home 1 day after the surgery. If the patient need a knee replacement or a hip replacement or something like a surgery of the spine, I ask to stay here maybe 3 days, maybe 7 days, depending the possibility of the patient and the time of the patient. If the patient can stay here for 7 days before he go back to home, I can remove the stitches and see the patient before and check the wounds.
Do they need some kind of physical therapy or rehab after surgery?
Yes, most of patients will need physical therapy. The most time I can explain the beginning of the physical therapy. I can give to the patient the schedule to check with pictures how can the patient do the exercises and to recover their movement and the flexibility. But sometimes they need to go to a specialized place to get the physiotherapy.
So how do you determine who's a good patient suitable for orthopedic surgery?
Okay, I really ask for pictures of x-ray, of MRI, of CT scan, and all that information like age, weight, height. If the patient has any disease, the patient need to tell me because I'm gonna take care of that information, and I wanna decide if the patient have in a very good shape for the surgery or have a very high risk to take the surgery.
So is there a chance that a patient sends all the information and they seem like a good candidate, but then they come here and they find out that they are not suitable for surgery?
Yes.
So what will make someone not a good candidate for this kind of surgery?
If the patient have a heart disease, some disease that form and thrombosis in the blood, is maybe the patient have a very high risk to get surgeries like orthopedic surgeries.
Who is a good candidate for knee replacement and who is not a good candidate for this?
The surgery to replace the knee or total knee replacement is a very, very good surgery that we can do to eliminate the pain in the knee. When we don't have cartilage or the damage in the knee is very advanced, it's very high. So to kill the pain, we have to remove the cartilage and replace it for implants. The best patients to accept the implants are patients that take care of the weight, patients that have no disease like diabetes, high blood pressure, people that are not taking blood thinners or anticoagulants are the best patients. But in the reality, the most people that need a knee replacement are people that have obesity, some disease like high blood pressure, diabetes. So what I do is accept the most people. There is no matter if the patient have obesity or something or some disease. If they accept the risk, I can do the surgery. because the reality is that people that is healthy, the most people don't have problems in the knees or in the hip. All people is a good patient for me. All patients are good for a knee replacement, but I prefer to see all the information about the patient, about the medicines that they are taking, all the disease, all the medical records. Okay? After that, I can take a decision if I accept the patient to come with me to make the surgery.
What are the alternatives or what are the things you should do before you consider knee replacement?
My advice, if you have pain in your knee, after you go to the doctor, a doctor determine if you have a kind of damage in the cartilage. And before you need knee replacement, maybe you can try to avoid the exercises with weight. You have to avoid jumping jacks, running a lot in the week. With that, you can diminish the damage in there and you can stop the damage in the cartilage. I have another advice. You can try with taking hyaluronic acid.
Ironic acid?
Yeah, or maybe you can try glucosamine, chondroitin, collagen, type 2 of collagen, or hydrolyzed collagen is very good for your knees. You have to keep taking it every day for 6 to 12 months to feel that the treatment is working in your knees. I highly recommend, if you feel pain in the knees, to avoid the weight, the excessive weight. If you have more weight that you have to be, you have to lose weight to feel much better. That's gonna be very good for you and your knees. Another thing you can do to diminish the pain in the knee is you have to avoid sugar. You wanna improve the repairing or the fixing of the cartilage by your body. If you avoid sugar, you have to avoid processed food. That's gonna be very good for your cartilage in your knees.
When somebody comes here for knee replacement, for how many days do they need to come? What are the steps? What happens day 1, day 2, day 3? Can you walk us through that, please?
Once we accept a patient to make the total knee replacement, you will fly or you will come to Tijuana. The first day you have to arrive fasting in the morning so we can take the blood samples in the lab. After that, we're gonna make a test of your lungs, of your heart, and a physician specialist in that in heart is gonna make a valorization, and he's gonna determine what's the risk of the surgery. After that, you're gonna come with me to my office so we can talk face to face, and I can answer all your questions about the risk, about the surgery, about everything you can ask about everything. After that, you can go to the hotel, and the next day we can do the surgery. I prefer to make the surgeries in the morning because everything is better in the morning. People have more energy and we can do the surgery much better in the morning. We make the surgery more, usually we can make the surgery at 9 o'clock in the morning and we can finish 11 to 12 o'clock. After that, I go to your room to explain to your partner how about the surgery was and how everything is happening in your knee. We can talk about the sizes of the implants I put, and after that you are gonna be in a recovery room for 2 hours. After 2 hours you will come to your room with your partner to stay there one night. The next day after surgery, I remove the drain of your knee and I begin to move your knee, flex and extend. If you feel comfortable enough, you can extend and walk the next day after surgery. If I see that you don't have fever, you are not bleeding, your wound it's okay, I can make the discharge. I'm gonna give you a prescription to buy antibiotics, anti-inflammatories, and painkillers. And after that, you can go home. In some cases, it's better to stay here in a hotel after the discharge of the hospital for 2 or 3 days to diminish the risk of thrombosis. If you have to fly to back home, it's better if you stay here for 2 or 3 days after surgery.
Any physiotherapy program or physiotherapy that you do or teach them?
The next day after surgery, once I remove the drain, my physiotherapy people come with you and they make some exercises for you. This person is gonna explain you how you will make the exercises. And if you feel comfortable and you want to stay here, Tijuana, for 2 weeks, if it's okay for you, you can come to the physiotherapy center to continue the exercises. This is gonna improve your advance very, very high. If you will come back very, very fast to home, we can make you a plan or exercises before you go to a physiotherapy center in your home.
Can you share what are the things one can do or one should do to increase the chances of success in a knee replacement?
The total knee replacement is a surgery very, very, very safe to the implants. The materials are very safe. But in some cases, that surgery can not go well after some years. So to improve that prognosis after surgery and increase the durability of the implants, you have to take care of your weight. Your weight is the key of this surgery. If you take care of diabetes, high blood pressure, you can increase that durability of the implants. You can use the prosthesis. You can walk, you can run if you need it. If you run like a marathon or something like that, Ironman, the implants is gonna last a little less. Okay. So you can avoid that. The implants is gonna last a long, long time.
Can you talk a little bit about what are the different brands of knee implants that you use over here, brands, and if you have models?
Usually I use brands like Stryker, Biomed, and Johnson & Johnson prosthesis. The implants are made, most of them, in the United States. There are other brands that are cheaper. Sometimes are cheaper, and they come from India, China, Korea. That implants are very good too. I can decide to use a brand depending the weight of the patient and the budget. If the patient don't have a very good budget to buy the best prosthesis or the more expensive, I can use another brand. All the brands are very good, but I try to avoid some brands if they don't have more than 10 years in the market. I don't feel safe enough with that implant, so I avoid it. It's a joint very, very complex because we have a lot of parts in there. So we can have fractures in the bone, damage in the cartilage in these parts, damage in the meniscus. The meniscus are very common. Another kind of damage is the ACL and PCL in the posterior part or posterior side of the knee. So we can make all the surgeries to repair meniscus, ACL, and PCL too. So if the patient feel comfortable enough, we can use ligament graft of another person, or we can use ligament graft of the same patient, depending on the decision of the patient. So to replace the ACL, the PCL, even the meniscus if the meniscus is too damaged. If the damage in the meniscus is starting, we can fix it with some sutures in there and some stitches in there, and the patient can improve in more or less, if don't have too much damage, in 6 weeks, and if the patient have a lot of damage, in 3 months. After that, the patient can come back to work and can come back to the exercises.
So, for how long does a person need to come for a ACL?
To repair an ACL, we need 3 days. You have to travel, you have to arrive fasting in the morning, we have to take all the pre-ops. If you already have the MRI, we can use it, or if you don't have it, we have to take the MRI 1 day before surgery to take the decisions in the plan and how we are going to fix the damage. The second day we make the surgery, and the third day you can come back home. It's very easy. The most time we do a very small wounds. We make all the surgery arthroscopic, so the pain after surgery is very small.
And what about meniscus repair? For meniscus, how many days do they have to come?
For meniscus repair, we need 3 days too. If you cannot stay in Tijuana too many days, only 2 maybe, you can make all the tests at home and you can bring me before surgery, blood test, the MRI. If you have everything, we can do the surgery in only 2 days.
So tell us a little bit about hip replacement.
Total hip replacement is a surgery very common because the cartilage in the hip can suffer damage during the life, because the hip is a joint that have a lot of movements, and every hip carried a half of the weight. When we walk, every hip carry all the weight of all the body up of the joint. Total hip replacement is made to replace the damaged tissue in there. So we have to remove part of the neck, we have to remove the head, and we have to work in the bone of the hip. Okay, we remove that and we replace it for implants in there. That implants can last for 10 to 20 years. So it's a very safe surgery to kill the pain and improve the life of the patient.
How can somebody avoid hip replacement? What are the exercises, lifestyle choices, and other things medically person can do to avoid hip replacement?
Some advices I can give you to avoid the total hip replacement is to avoid the impact exercises. Yeah, you have to avoid running a lot, jumping a lot, carrying weight a lot. You have to avoid that. You can do exercises, but you have to avoid the excess of that exercise. If you do a lot of exercises, can damage your joints. You have to avoid excessive weight in your body. You have to be in a good shape. If you have a lot of weight in your body, you have obesity or something like that, the excessive weight is gonna damage the cartilage in your hip. If you have a lot of weight, just lose it. There is no matter the way, you have to lose it. You can take care of the food you take, you can do more exercises, or you can take a surgery to lose the weight. You have to stop taking sugar. Sugar damage all the cartilage of your body.
What foods one should eat which are good for your hips and knees, like protein, collagen? Can you talk about those?
no processed food, more vegetables. You can take a collagen, hydrolyzed collagen, type 2 collagen, chondroitin, and glucosamine. You can take that supplementation of the food for 6 months. Then you can take a rest for 1 or 2 months, and you can continue taking for another 6 months. We can take vitamins for another things, or we use some gels to take care of the skin. Is the same, but in this case is taking. There's no matter the presentation of that supplementation, but you have to take the supplementation for 6 months to 1 year.
Okay.
The magnesium, the protein is very, very important for the joints of all the body. We have to take it. The exercises is very important to the joints, because the cartilage have a response to the weight. If we move, if we do exercises constantly, avoiding the excessive weight, the cartilage is still very, very healthy. If the cartilage has to repair because have a little attrition, a little damage in there, it's stimulated to fix it faster. If you do exercises, if you take care of the food that you take, and if you lose weight. After a surgery of hip replacement, the patient have to avoid lower places to sit, because if the patient sit in lower places, the components can be dislocated. They don't have to do movements like a fork to cross the leg. They have to avoid that, because increase the risk of dislocation of the implants.
Is that just for the first few days or forever?
It is for 6 months.
Okay.
I have a very, very good story from a patient that come from Canada. He is a jiu-jitsu trainer. He's very, very young. He's like 51 years old. He told me, Dr. Hans, I have my hip is very, very damaged. I feel too bad because I cannot move. I cannot do my job. I feel very, very depressed. So I see all the x-rays, and I determine that he will need total hip replacement. So I choose some components that are special made for young people. The implants are more smallest. The head is from ceramic, and we can use components that they last for more time. He traveled to San Diego, that the San Diego airport is very close to Tijuana. So he traveled to San Diego, make the transportation to Tijuana, and in 3 days, we changed that hip for a new one. It's amazing how the patient, the next day of surgery, he was making flexions here in my office. He's talking about how he feel all the pain disappear. He is right now training jiu-jitsu. That was amazing. The last day when I make the discharge, he come walking to my office and he give me a hug.
What are the spine surgeries you do? What exactly they mean, and how do you do that? Maybe the problems you can show in this model, please.
The spine is a very, very common source of pain in the body. Maybe someday we feel pain in the neck, feel pain in the back. Maybe sometimes we feel pain in the sciatic nerve. So it's very, very common. That pain can be produced for an attrition or damage in the disc. In this part between the bones, we have a disc. The disc have a tissue that is more or less soft in some parts. We have a ring in the outside, and in the middle we have like a gel. With that, we can do this move when we stand up, when we carry weight, when we move. That's why, because the spine have a lot of joints. So we have different treatments If the damage in the joints in the posterior side is beginning, we can put stem cells in there, we can put PRP in there to stop the damage and prevent the pain. Okay, we can, if the damage is in the disc, we can put inside inside the disc some PRP or stem cells. Okay, this is for the beginning of the damage, for young people, for person that make exercises, make some kind of sports, and is beginning with damage in the spine. If the damage is a little high, is if the process continue and the patient have damage in the disc, that the disc is herniating, maybe level 2, level 3, we can make another kind of treatment.
What is herniating? What does herniation mean?
In this part, in the posterior part, the disc go out and compress the nerve. That's mean when I say that the disc is herniated, is because the disc go out and compress the
Compress this.
yeah loses the narrow. The herniated disc is in the neck. The pain go to the back, the shoulder, and can travel to the hands. If the herniated disc is in the lower back, the lumbar part, the pain can go back to the hip and to the foot. Okay. So depending in the level of the spine, we can make the treatment. The second level of treatment is the nervation. We can damage the nerves, the pain nerves, to stop the pain. And we can use a needle to introduce in the disc. With that, the disc goes smaller. We can make it smaller. So with that, the herniated disc is gonna decrease the size. And with that, we eliminate the compression of the nerve.
What is that procedure called of the needles that you use?
The name is rhizolysis, the nervation of nerve with hot.
Nervation of the nerve with warm, hot. Okay.
Hot.
Okay. So that's one procedure you do.
Yeah.
Okay.
And all of that is made only with needles. We don't have to open the wound. It's not a surgery. It's ambulatory process. You can come one day and you can go home the same day.
Okay.
You can walk after surgery. And with that warm we use to damage the nerve, is gonna last for 6 months to 1 year. Even some patients feel good for 2.5 years or 7 years, depending the level of damage of the disc. In some patients, the disc can be herniated and they go out of the ring. If the ring is damaged and broken, the interior side of the disc can travel to the posterior side and can compress the nerve. So with that, we have a lot of pain in the back and a lot of pain in the leg. If the herniated disc is in the right side, we will feel pain in the back and in the right leg. If we feel pain in the left, that means that the problem is in the left side of the disc. So we have a surgery that is minimal invasive. Minimal invasive means that we can do a surgery that even can be as smaller as 1 centimeter. Okay, with that we can introduce a very small lens to see the disc directly. We have to remove the herniated disc, only that part, not all the disc, to avoid the compression of the nerve, and with that we can stop the sciatic pain.
So in this surgery, how many days is the patient hospitalized? Just one night?
Yes, one night. For this surgery, the patients arrive to the hospital early in the morning, fasting. We take test blood, chest, X-ray. We can make a valorization of the risk. After that, we can do the surgery, and the patient on the next day can go home. If everything is okay after he walk and he feel that the pain's gone,
So they can fly back home the following day?
yes, the following day. With the scar is like this. It's very small.
And do they need recovery time?
The recovery time, I really try to explain to the patient that after we remove the herniated disc, the disc have to be healed, and that takes 6 weeks after the surgery. The patient have to avoid carry weight and do exercises with impact like running, jumping, and workout. 6 weeks have to avoid it. If the patient have a lot of movement because the joints are damaged and the ligaments are not working as well, or the spine, the space between the bones is very, very small, we have to make a surgery to stabilize all the joints. So we have to use screws to put it in the bone, some titanium bars to create an stabilization in the back. Even we can change all the disc for a new one implant. With that, we can stop the pain.
So the stabilization process is called spinal fusion.
Yeah. The spinal fusion is a surgery when we have to change all the disc and change it for an implant to make a fusion between this bone to the other bone. And in the posterior side, we can use some screws to fusion the posterior side. With that, we can stop moving the vertebrae and we can eliminate the pain.
What are the easier alternatives to spinal fusion? How you can avoid spinal fusion?
Spinal fusion is made in patients that segment of the spine have a lot of movements. If the movement of this segment of the spine are causing the pain, we have to make the spine fusion. We can determine if the patient needs that surgery, making special x-rays with movement, dynamic x-rays of the spine. When the patient flex a lot and extend a lot, and with that we can determine if this bone is moving a lot. If the spine is moving a lot, we have to make the spinal fusion.
Do you also do PRP or stem cell for knee pain?
We have both.
What is PRP?
It's a process where we take the blood of the patient, we take some blood samples. So we have to use a machine to separate all the components of the blood. So we have platelets in the blood, and we can use only the platelets. They work inside of the veins and arteries. If we suffer a cut in the veins, the platelets stitch in there and they make like a peeling tissue in there and they stop the bleeding. The platelets have a lot of effects, but the most important is to stop the inflammatory process because they block the interleukins and they are make like a sign to call the fixation cells to come to the tissue and repair the tissue that is damaged. The PRP treatment is a treatment where we can use the same blood of the patient. We can make a separation of the platelets in there, and we can use it in the places when we see that the damage is more advanced. So if you have a attrition or you have damage in the cartilage in this part of the knee, in the condyle, we can use the PRP inside the knee and we can put it inside the bone, okay, in the posterior side of the cartilage to improve the healing process in there. Okay, the PRP is gonna help you to eliminate the effect of the interleukins in there that they are making the inflammatory process. So the platelets stop it, the interleukins. Okay, and they are like a signalization, like a sign in the tissue to call to the stems, the cells, to repair the tissue, to fix the tissue, to increase the healing process.
For how many days does a person need to come for PRP?
We have two choices. If the damage is starting, is not too much, is in the first level of damage, you can come. I can put PRP in the place only once every week or every 2 weeks. If you can come every week for 3 times, it's gonna be the best treatment that you can take. The same day I can put it and you can go home. It's very easy. If the damage is level 2 or level 3, if you have 50% or 75% of damage in the cartilage, I have to do the other, where I have to put the PRP inside the bone and inside the joint. I have to use the surgery room to do that. It's a little more expensive, but it's more effective. Okay.
In that case, how many trips they have to make?
We have to do all the pre-ops one day before. The next day we have to do the process, and if you feel comfortable after the process, you can go home. And we can do a booster after 6 months. And if the MRI after the second application, we can see that everything's okay, the pain is stopped, that's enough. If you feel pain after 6 months after the second application, we can do another treatment.
Okay.
If you have damage in the meniscus,
Mm-hmm.
we can put it in the meniscus. If you have damage in the ligament, in lateral ligament, we can fix it applying the PRP in the ligament directly. So I use an ultrasound to determine where is the damage place, and I can put it in there. We have to be very precise with the PRP and the stem cells application, because once we put in there the tissue is gonna work in that place. So we have to do sometimes in my office I use the ultrasound, and sometimes I have to use the surgery room if I need x-rays to put it.
You do PRP for what all body parts?
Okay, the PRP can be used in all the body, all around the body. For example, I can use the PRP in the facets, the joints in the spine. I can use it in the disc. The herniated disc is the beginning. I can use it in the hip to improve the pain and to heal the damage in there, to improve the regeneration or the fixing of the tissue in the cartilage in the joint of the hip. I can use it in the knee. I can use it in the ankle, in all the joints, all the tendon, basically, and all the body. I can use it. If the patient have damage in there, in the joints, in the cartilage, or the tendon, we can use it. It's very, very safe to use it because the PRP is from the blood of the patient, and the risk of infection is very low. So we can use it in the joints of the hand too, in the tendons, to kill the pain of the carbying process, of the tendinitis process, and arthritis. It's gonna help you too.
What stem cells you do? How do you do it?
Okay. Stem cells are treatment what we can use in some patients. We have to see all the information about the patient, about the disease, about if the patient have other problems. But if the patient is a good patient to receive the stem cells, we can use it. The most common stem cells we use is umbilical stem cells for the cord of the umbilical cord. The laboratory send the stem cells in a cold chain. The high-ranked laboratories from Mexico and is certified for the government. Once we get the stem cells, we can use it in different parts of the body. We can use it in the netted disc. We can use it in the joints. We can use it in the shoulder, in hips, in knees. Basically, we can use it in all the body depending where is the damage. To use the stem cells, sometimes if the damage is, for example, if it's in the meniscus, we can use an ultrasound to put it in there, and it's very easy, and the patient can get the treatment and go home the same day. But if the damage is in the cartilage, we have to go to the surgery room to put inside the bone. So in these cases, we need 2 days. You can call, we can make all the arrangement the first day, and the second day we can make the procedure, and you can go home the same day of the procedure. To decide if the patient needs stem cells is if the patient wants to avoid the surgery, we have to use the stem cells. The stem cells are made or a study have been studied for many years in parts of the body that the damage is very advanced. So we can use it in there. If you want to avoid surgery, we can use stem cells, basically.
And in how many days or months can a patient see improvements from stem cells?
Okay. Once we put the stem cells, you will feel improvements maybe 1 month after the procedure. The stem cells have to change and make like a differentiation of the cells in the tissue where we put it, and that is gonna last for 1 month, more or less.
So how many trips does person need to make for stem cells of orthopedics?
The plane or the treatment you need if you use stem cells is in 2 troubles. Once the first one, and the second one is in 6 months after the first one. In the second one, we can use like a booster in the same place to improve the regeneration treatment. And after that, if the MRI, after 6 months of the second treatment, the MRI, we can see change in the tissue, it's enough. You don't need any more trial.
Okay. What are the risks of stem cells for orthopedics?
The risk of stem cells are very, very low. The laboratory take care of the preparation of the tissue, and they give us the stem cells in a deposit that is very, very safe. They send it in a cold chain because we have to see that the temperature is not changing during the travel, and it's very cold. But some patients have allergy to the components, maybe make like a reject of the treatment sometimes, but that happen in very, very small percentage of the patient.
Treatment with stem cell permanent?
Okay. If the patient is starting with the damage, the stem cells treatment can be permanent. There is no warranty in the treatment because all the bodies have different response to the treatments, but if the body accept the stem cells treatment, the change in there can be permanent in the future.
How do you decide if the patient should have a surgery, a meniscus or ACL tear surgery, or instead do a PRP? How do you decide?
And to decide if the patient need a surgery or a treatment conservative like PRP or stem cells is depending the range of damage in the tissue. If the damage is starting in the meniscus, for example, if the meniscus have a very small damage in there, we can put PRP or stem cells even in the damage in the tissue. But if the damage is too advanced, is the level 3 or 4, and the meniscus cuff is 50% or more of the tissue, we have to make the surgery. It's much better for the patient, and we all the time we try to avoid excessive treatments for the patient. That's why we have to take a decision depending in the MRI pictures that we can analyze.
Are there any risk or complications in orthopedic surgery?
Orthopedic surgery have a lot of a risk, but depending the surgery. For example, if the patient want a knee replacement, the principal risk are thrombosis, bleeding, infection, and pain. Persistent pain are the most common risk for the surgeries. The risk is gonna depend of the age of patient, if the patient have diabetes, high blood pressure before the surgery, if the patient are suffering of arthritis or have another disease before the surgery.
Okay. So how do you tackle those risks on international patients if a patient is going back home after surgery?
To decrease the risk, we can use anticoagulants to fly. We can immobilize the limb that is operated, and we can use antibiotics to diminish the risk of infection. Some surgeries can have more risk after the surgery, but if the patient follow all the recommendations and can stay here for 1 week or 10 days after the surgery, we can do every surgery on an orthopedic surgeon for the patient. There's no matter if it's on the spine, if the patient follow all the recommendations and take care of them, he's gonna be okay.
When the patient goes back home after having surgery, do they have any follow-up with you?
Yes, we're still in touch. The patients can send me messages for all time. I'm 24 hours available, and if the patient feels something wrong, can call me, can send me pictures, photos, or videos, and I can recommend to the patient. If the patient need an X-ray, I can send the order to make it wherever the patient is.
Okay. So what if a patient has complications, like if something happens once they are back home, do they have to come back here, or can they be treated back at home?
The patient have two choices. If it's comfortable and the possibility to come back, I can fix it. I can help the patient with the complication. If the patient don't come or choose to get the treatment in his city, he can go there with a doctor, and I can explain the patient what he needs exactly.
Okay. So when the patient is discharged, will they have paperwork from you in English so that they can bring to their doctor back at home?
After the discharge, I can give the patient a paper in English when I explain all the procedure and diagnosis. Okay. To get the hospital is very easy. You can fly to San Diego or drive directly to the hospital. If you need a transportation, we can go for you if you live very close, or if you fly to San Diego airport, we can go for you.
Patients traveling from another country, will they need a passport?
You live in the United States, you can travel and cross the border with a passport. If you live outside of the United States, maybe in Canada or another country, you will need a passport. The patient want to travel to Tijuana to get a surgery, and the patient book through the MTC. They can assist the patient to get the hotel transportation, and if the patient have a very painful surgery or a big surgery, can stay in a recovery home after the surgery, and all of that is assisted by MTC.
What payment methods do you accept?
Okay, I accept cash, credit card, and bank transfers.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.